the Health and Medicine Program of the Center for the Study of the Presidency and Congress has worked on a number of challenges and opportunities facing the administration that needs those kinds of bipartisan solutions. We put out 2 reports in advance of the healthcare reform legislation, called for a national obesity campaign, and among other recommendations to advance global health, to increase our investments in research and science. And that's what brings us to this issue today. You've heard from Senator Wyden and from Senator Chambliss, why you're all here today, that there are 2 serious public health problems facing our nation today: food insecurity and obesity. It's a perilous American paradox in our country. And it's why we brought together, and with the support of the Aetna Foundation and the Robert Wood Johnson Foundation's Healthy Eating Research Program, this initiative. We gathered a dynamite team. They're all here today. You will hear from some of them, and I'll introduce them to you later, with the assistance of our great center staff, Elaine Hofnagel, I want to particularly recognize, and Haley Laughlin and Vanessa Hoffman. But we then did a study, which I'll tell you about in segments, to chart a new strategic vision for SNAP in the 21st century, to really have an opportunity not just to feed people, but really to improve public health. And that brings me to all of you. This was the 2005 Time cover, where in the information age, each one of us here in this room has a powerful opportunity to improve health and the economy and national security of our nation, using the tools of public health and science, from our investments in research, and translating that into evidence-based policies and educational messages. And that's what we strive to do today for SNAP. You all are here because you know that food insecurity is a major health problem in our country today, currently affecting 1 in 6 people in the United States are food insecure. Historically, food insecurity has been associated with thinness and underweight, but today it is also associated with obesity. Food insecurity and poverty are associated with significant social, economic, and health consequences. These risks include more needed medical care, increased hospitalizations, inadequate intake of key nutrients for kids, lower academic achievement, and in general, poorer overall physical and mental health. You've heard and you know that food stamp use has increased dramatically since this current economic recession. In fact, the use of food stamps has gone up 60% since 2007. It's a critical safety net that needs to be preserved for 42.2 million people in our country today. And this slide just shows you that rapid increase in utilization of food stamps as a critical safety net for Americans since the economic recession. 1 in 7 Americans are currently enrolled in this program, of whom 50% are children. This slide shows you the eligibility for food stamps. It's for a monthly income at or below 130% of the federal poverty level. But did you know that 28% of eligible Americans are not enrolled in the program, either because they don't know about it, don't know how to access it. The average benefit was $133 per month per person. It's also not just a health program or a food program, but it's an economic stimulus in the communities around our country. For every dollar invested in SNAP, there's a return on investment of $1.8 for communities. Now, what's included? What can you buy on SNAP? Well, most foods are supported, and plants and seeds that can be grown for consumption. There's only a few limitations on what can be bought in the program. You can't buy alcohol, tobacco, vitamins, pet food, hot food, or dietary supplements. The history of SNAP, well, it was established in 1933, at least the precursor of it, during the Great Depression under President Roosevelt. It's evolved over time into a food stamp program. In 1964, President Kennedy established the program that was signed into law by President Johnson. However, as the program has evolved, in 2009, its name was changed to the Supplemental Nutrition Assistance Program in recognition of the obesity epidemic that was occurring in our country and to put an emphasis on nutrition. However, that name change has not been paired with the kind of accelerated progress that we would like to see in terms of strengthening the nutrition of its participants. Since 1964, a number of things have changed since the program was first established. Family farms have all but disappeared and been replaced by industrial agriculture. During the same period, our government has spent large sums on agricultural subsidies to support high-calorie commodities at the expense of more nutritious produce. And as a result, highly processed products form sort of the core of the U.S. diet, and we've seen the proliferation of cheaper fast food products. Costs of fresh foods have increased, there are larger portion sizes, we've seen billions of dollars spent on media and marketing for unhealthy foods, and paired with a reduction in physical activity in America. In fact, the average calorie consumption has increased about 20% since the 1970 level. On average, Americans have gained 25 pounds since that time. And this slide, which you're all familiar with, I'm sure, shows just this incredible rise in obesity rates since 1994 in our country, really over the past generation. In the 60s, 5% of American children were obese. And today, as you know, the number has escalated to 30%. Health consequences of obesity affects almost every single organ system of the body. So it's a serious problem. And obesity has resulted in increased risks of diabetes, type 2, heart disease, some forms of cancer and stroke, and it has severe economic costs. It costs our country $190 billion in 2009, and also results in a 40% increase in medical costs for obese people compared to ones who are not obese, and will result in lost productivity in the workplace, absenteeism, and other economic effects. It's not just an adult problem, as you've heard today, it's a children's health problem. 1 out of 3 children are obese or overweight in our country, and 1/3 of children born today will develop diabetes in their lifetimes. As a result, this may be the first generation of children who is not as healthy or live as long as their parents. And this slide just shows that increase. Well, it brings me to the concurrent threats that, as I said, perilous American paradox of food insecurity and obesity, and why the SNAP program needs to be updated to address these concurrent challenges.